The fact of the matter is that everything we know about infant mortality, everything we know about producing a healthy baby, regular medical care, good nutrition, a job, health insurance, with all of those factors, Black women who have graduated from college have worse birth outcomes, higher infant mortality rates than white high school dropouts.
On February 24th, 2012, Tulane University held its first Black Women's Health Conference. The conference aimed to raise awareness and increase knowledge about health-related concerns that disproportionately affect Black women by bringing together academics, practitioners, and community members to develop a common language for talking about and fostering Black women's health and wellness.
It's not often that you get a chance to reflect on Black women. I mean, we've always been kind of caretakers, taking care of other people, and it's great to come together with women who are concerned about our issues and our health, our community, and I think this is a wonderful opportunity to be able to network, to be able to analyze the issues that are critically facing us as Black women, and to strategize on ways in which we can help each other.
Just promote and spread an atmosphere of recognition and activism around the issues of Black women's health. Discourse and talk about what goes on in the lives of African Americans, especially African American women. It rarely ever happens.
Women from the community, young girls from the community, students and working people alike, academics, social workers, physicians, together to have a conversation, to begin a dialogue about Black women's health, what the facts are, then to start to dialogue about what we need to do about them to change those current facts to improve things for the better.
Black Women's Health Conference is an opportunity to celebrate Black women, to bring understanding to some of the challenges that Black women face. It's also an opportunity for us, men and women, to come together to have a clear and very fruitful discussion about the next generation.
Things are getting much worse, like for example, infant mortality rate in the Black community, breast cancer, failure to conduct mammography. It's a really good opportunity for Tulane University, actually, a good community. I really enjoyed the speaker yesterday, Takesha Davis.
The Black Women's Health Conference began with a keynote address at the inaugural luncheon by Dr. Takesha Davis, Director for the Center for Community and Preventative Health, Medical Director for the Louisiana Department of Health and Hospitals, and Assistant State Health Officer for the Office of Public Health.
But we don't allow ourselves to reveal enough about our own experiences, our own trials, our own difficulties, to begin to allow us to work on them. So I hope that with this conference, you find a safe environment that you can dialogue about your issues. And so I'm going to start today by telling you about mine.
The conference featured an introduction to the Black Women's Health Scholar, a program for involving high-achieving high school students in assisting with the goals of Black Women's Health Conference, namely serving as liaisons between the conference organizers and the schools they represented, taking what they learned from the conference to give access to their peers. Jennifer Williams, the curator and director from the McKenna Museum of African American Art, presented a slideshow, Sex Crimes Against Black Girls Project.
As I said before, it's not an issue of just individuals have been affected by sexual abuse, but it's an issue of how can we all come together as a community to address these very powerful things. This is something that affects women and men throughout their lives. It's not just something that happens when you're young and you forget about it.
Dr. Maureen Lichtfeld, the Freeport-McMoran Chair of Environmental Policy and Environmental Health Sciences, spoke on the challenges and opportunities to reduce health disparities for Black women.
And so often when people say, if we only created more clinics and if we only had a healthcare agency on every corner of the street in the Gulf Coast, we should be fine. And that's not the case, because you'll see that access to healthcare doesn't equate to quality healthcare. Don't forget that. So access does not equate to quality.
Black Women's Health Conference also included a talent competition for local high school students. and a red tent sponsored by the Institute of Women and Ethnic Studies. The red tent included refreshments, relaxation therapy, and a story circle where participants were invited to speak about their feelings and experiences. Dr. Denise Shervington is the president and CEO of the Institute of Women and Ethnic Studies.
I never heard a baby cry in Zimbabwe because they were always tied on their mothers' backs. And they slept in the beds with their mothers, just always touch. And I remember leaving Zimbabwe and heading to Paris. And as I landed, the kids were screaming and yelling. And a Zimbabwean woman said, "I don't understand you Westerners. You push your children away from you in strollers." And I always recall that because for me, when I bought, in my very bourgeois days, it was so important the kind of stroller I bought for my child. You know, I got the one that Prince Harry got. My kid was born around that time, and I didn't even call it a stroller, it was a perambulator. And I remember in that moment, I felt so deflated by the truth.
As the last speaker just talked about, this notion of touch is very important as we're younger. So it's important for us to remember as we get older that as we need to continue to understand this sense of touch and love in a very safe way, and to show that we're sort of connected. Because, you know, black women are the basis of our community.
Dr. Linda Ray Murray, president of the American Public Health Association, gave the morning plenary for day 2.
My son turned 40 last year, and I'm not ashamed to tell you I've had post-traumatic stress syndrome. I haven't recovered from his teenage years yet. But when he was a teenager, there sat in my living room a bowl of condoms. It stayed there all the years that he was a teenager. And it regularly got empty. Now, I'm sure a lot of the condoms were just to show off, you know, among their friends. You know, I'm not a fool. But nonetheless, I tried to keep it full. Because I'm trying to save some lives here.
I thought her talk was outstanding. I thought it was approachable. I thought it laid out the facts clearly as they are from what we know from very good empirical research, as well as some sort of anecdotal and lay person's thoughts about how that matches with current research, and having some ideas about what we can do about it. I really, really enjoyed that talk.
Day 2 of Black Women's Health Conference also featured a host of scholarly addresses by practitioners in fields pertaining to women's health, as well as doctoral candidates from Tulane and Louisiana State University. Black Women's Health Conference was highlighted by the keynote speaker, renowned cultural critic and author, Joan Morgan.
So basically it was a struggle to do that kind of cultural criticism because you had to fight for the space. However, I would say 20 years later, fast forward, it's a struggle to want to do any kind of real critique and not have to talk about it vis-a-vis a celebrity. So it's really difficult at this point for me to get the space to write about domestic violence of teen girls, unless I want to do it by talking about Rihanna. And so I want to ask us, what does that mean to ultimately have to filter the issues that are most pertinent to Black women's health and welfare consistently through the prism of pop culture and media? Well, it does mean that instead of developing new and necessary frameworks, that we spend a whole lot of time reacting to the ones that exist.
I think this was a very good start, in that the topics are very broad and diverse. I think the future conferences may want to be more focused on specific topics. They have a 2-day conference on one particular issue, so we can go in a lot more depth on one issue.
The theme of 2013 will be violence against Black women, and we're broadly conceiving of violence so that we can invite participants to address a cross-section of sub-themes that arise out of the concept of violence. We would also like to address some of the more pressing recent issues that have organized around human trafficking through domestic violence, violence as it relates to traditional crimes against humans, disproportionate rates of rape and incest among women of color and children. The call for papers will launch in July, and planning will begin aggressively thereafter. you.